First of all, I'll enumerate 4 things that I tell my patients to deter them from committing suicide and all. When people come with this suicidal attempts and all, history of suicidal attempts, after the suicidal attempts when they are brought to by OPD, then what I'll tell them is that, what we have to understand is that things will change. Things will change for the better. Of course, this corona situation also will change. After few months or years, we don't know how long it will last exactly. Things will change. Of course, hopefully vaccine will come soon, and things will, people, we will live with corona in the future days, and we'll get adjusted, and things will change. One reason why people with suicidal ideations and resort to suicide is that they think that, oh, this is the end of everything, and there is no way out. But what we have to understand is that I myself, with my own eyes, see people in the OPD when they the first visit how they are, and when they come for the review how they are. Recently also I was telling this example of this. Many examples I can say where first visit they will be so distressed and agitated, and they are not able to sit quiet, and so distressed and tearful, and with counseling and with medicines and all, after some 10 days or 20 days or even 1 month, when I asked them to come for review, the things would have dramatically changed in most people, of course. Most people, more than 90% of the symptoms would be over. They will be very calm, and they will be very restful. So there is, of course, counseling and medicines will help them to tide off this crisis, to help them to feel better. And of course, the situation, the outward factors like the corona, the financial problems, the job-related problems, interpersonal problems, of course, will change. Nothing is an end by itself. Everything will change. There is a story you would have heard about this king and the minister. The king wanted all his subjects to tell a phrase that can be that is apt in happy times as well as in sorrowful times. So everybody was scratching their heads what to say. One particular phrase he is asking that should be applicable for both joyful times and sorrowful times. So, and finally the minister said, this also will change, iduvum marum. This also will change. So that was an apt phrase. Even if when you are joyful also, no need to be overjoyed or overwhelmed, because that joy also will change. After some time it will change. The situations will change. Even if it is sorrow, like this corona situation, that also will change. After some time, things will change for the better. So, things will become better. If there is a mountain, there is a valley. If there is a valley, there is a mountain. So, if there is a night, there is a day. Even in the ECG, you would have seen the fluctuations in ECG. There will be dips and heights. So, like that, in our life also, there will be dips and heights. When you are in the dip, we think that is the end of everything. No, that's not. That is actually, that is the lie of the devil, we can say, in a spiritual perspective. It is not the end of everything. Everything will have a, when there is a night, a day is coming up. Dawn is near. So, like that, instill hope in people who are depressed, and, with medicines and with counseling and all, things will change. And another thing second thing that I was telling about the 4 things that I tell patients with suicidal ideations. One thing is that things will change with medicines, counseling, situations itself will change. Second thing I will tell is that if you commit suicide, many people who try committing suicide and all, they think that with their attempt, the burden of the family will decrease. Anyway, I am a burden to everyone, I will die and go, and burden will decrease. Then I will ask them, has any family's burden decreased because of anyone's suicide? Never. Because of suicide, the family's, society's burden will increase only. Never, it will decrease. There will be, even after suicide and all, how those family members will be affected. I usually tell them, when you feel like ending your life and all, you can think about your most loved ones, your own children, your parents, your spouse, your well-wishers, your friends, your teachers, your neighbors, people whom you love the most. Remember about them and think, how they will feel if you go away from here, how they will be grieved. And even after the suicide and all, many families, how much of stigma and burden they are suffering, and how much of reproach and misunderstanding from the society and rumors from the society they are facing. And I have seen many cases where after the even today morning, one family had come when they came with a 14-year-old girl. Her brother had committed suicide some 6 years back, and even when the grandmother was narrating the story, she was tearful. Even after 6 years, she is tearful about that brother who hanged himself, and because of all that and so many problems in the family and all. So what I would say is that with suicide, burdens will never decrease, but it will only increase. And third point, what I would say is that, suppose actually your suicide is unsuccessful, you attempted and it is unsuccessful. Sometimes you will have to suffer the lifelong consequences because of the harm that caused by that hanging attempt, or some medicines or some toxic things that you ingested, or some burns that that you sustained. There will be lifelong consequences. So with that stigma, with that scar, you have to live your whole life. So why you should attempt. And then the fourth thing that I would say is that, don't think that this is an escape mechanism. After life also, of course, we need to give an account to the God who created us, and it is from a frying pan to the fire. So don't think that you are escaping and everything is going to end. So there is an afterlife account that we need to give to the Creator. So like that, some 4 points I was just enumerating to tell people who are struggling with suicidal ideations and all. Of course, they need much more counseling and medicines and all to help them to come out.